Good afternoon. I'm Dan DeRosa with 19 News Now, coming to you from our digital desk yet again. Of course, we are talking about the smoke in the air from the Canadian wildfires, the air quality warning from the U.S. EPA, the Environmental Protection Agency. You don't have to look far. This is a live picture of downtown from our Science Center, Great Lakes Science Center camera. See the cars moving there on Shoreway. That is a live look. That is the amount of smog that's in the air, the amount of smoke in downtown. It's actually not as bad as yesterday, but it's getting worse than it was this morning. We've seen the levels jump from about a 120 to 130. We're now at about a 158. It's gone up. That's nowhere near where we were yesterday. The worst point yesterday, our index, when we're talking about these numbers, it's an air quality index from the EPA. Yesterday, the high point for Cleveland was 291. That's the highest it's ever been since they started recording this air quality index. So we are quite a bit down from that, but there are areas south like Canton, Worcester. They are in the 200s, the 240s. That's where Cleveland was for most of the day yesterday. But we want to talk about, well, what can you do? You may be one of the people that has to go out from time to time. Health officials asking people to spend as much time inside, windows closed as possible. Yes, you can have your air conditioning on with the windows closed. There's this huge misconception that when you turn on your air conditioning, it's pulling in air from the outside. Your car may do that, but your home AC does not do that. Your home air conditioning, heating, it's pulling air from inside your house. It's going through that filter, so it's actually a good thing to run either your whole house fan through your AC or actually turn on the air conditioning. It's a little warm today, so you may need that. Hopefully that is an option. It obviously is not for everyone. But let's say you are the people who are having these issues, burning eyes, coughing, itchy, sore throats. What can you do? That's why we like to bring you experts here with Cleveland 19. We're talking with Chris Pescic. He is the Director of Pharmacy Operations for Drug Mart. Chris, how are you today?
Good, doing well, thank you.
Hey, we appreciate you spending some time with us, and we want to get to the very obvious before we start our conversation. Folks, if you are at home and you are having an extreme time breathing, you are seeing some of these extreme issues. Number one, if it is that serious, call 911. If you can't breathe, it's very simple. If you have pretty agitated issues, maybe you need to call your doctor's office or go to an urgent care. When we are talking to Chris here, we are merely talking about over-the-counter type situations that might be able to get you some help in this while we're all dealing with this over yesterday, today, and perhaps again tomorrow. Chris, I think we've laid it out enough that in emergency situations, call 911, go to the hospital. So let's start our conversation. What are your pharmacists seeing? Are people calling in? Are people coming in? And what are they saying?
Yeah, we have the benefit, or at least I view it as a benefit of being very accessible. So you don't need an appointment to talk to your pharmacist. You don't need to sit in a waiting room for an hour. So when something like this happens, where it's kind of this temporary environmental thing, our phones do ring a lot more. People stop into our pharmacies, and we're getting questions about what can I use over the counter if I'm having symptoms related to air quality, or people may be refilling their prescriptions on their inhalers or their allergy medication and things like that.
So you are seeing calls. What are the types of, what are people complaining of? What are the symptoms that your pharmacists are seeing?
It's kind of what you would expect when there's air quality issues. So you're having breathing irritation, coughing, possibly some nasal congestion when you're having the air quality like it is today. The other thing too, sometimes is with the eyes you mentioned earlier, is you're going to have irritated eyes, and possibly related to all of the above, then sometimes some headaches and things like that. And when I say those symptoms, those are for just average adults going about their day outdoors. As you mentioned earlier, though, if you do have a pre-existing condition like asthma or something like that, even more important that you try to stay inside if possible.
It is. We've heard those warnings, and that's what's different about this time around. We dealt with this 2, 3 weeks ago. It wasn't near as bad in Northeast Ohio as we saw in New York. Well, now it's our turn. We're getting the worst of it. Chicago getting the worst of it, and people at home are having to deal with it. So let's go through just if anybody's watching this and it's the eyes, it's the coughing, it's the nose. What do you recommend? And again, we're not talking about if it's so serious you need to go to the doctor or call 911. We're talking about maybe I can get through this on my own. What are you recommending? What are your pharmacists recommending?
Yeah, for those of us who, for one reason or another, can't remain indoors during this and have to spend some time outside, or choose to spend some time outside if we don't have something significant going on. Um, Oftentimes, one of the best things that you can do from an over-the-counter medication standpoint is an antihistamine. So you're familiar with brand name drugs like Claritin or Zyrtec or their corresponding generics. And often if you kind of take that in a prophylactic way or in a preventative way, so you take that medication, if you know you're going to have to be outside tomorrow for 2 hours doing something, you take that in the morning before you're outside to try to limit the symptoms that you're going to experience from the air. Uh, for other people who suffer more so from nasal congestion, there are nasal sprays available like Flonase or Afrin. You don't want to use those for too long, but hopefully this won't stick around that long. So if you needed to use something like that for a day or two, that's a good solution. And then antihistamine eye drops if you're having more so the watery, itchy, agitated eyes. Another thing I'll point out too, for people that do see a doctor for some kind of breathing issue and may have an emergency inhaler at home, now's a good time to make sure you have that with you if you're going to be traversing outside. And another point about that would be to check the expiration date on those. Sometimes people who don't use their inhaler very frequently forget to check, and those do expire after a period of time.
I saw a phrase today that I'd never seen before. I was on the Ohio Department of Health's website, and they talked about an asthma action plan. I had never really heard of that before, but it makes sense. I'm not sure if you know much about that, but when it comes to people with asthma, COPD, what do they really need to pay attention to?
Yeah, so we already mentioned trying to remain indoors if possible, but then the other thing would be if you have a preventative medication. Often people who suffer from a breathing condition on a chronic level do have that, something they use every day, even when they're feeling good. It'd be making sure that you're using that appropriately as recommended by your physician or your prescriber, and then having that emergency inhaler with you if you're going to be going out of doors, so that it's with you when you need it if you happen to have some lung irritation due to the air quality.
Yeah, we can see where that would all be very important. We are speaking with Chris Peshek. He is the Director of Pharmacy Operations for Drug Mart. Chris, we always like to leave our interviewees with the final word here. When it comes to over-the-counter medication, when it comes to this air quality, what do you want people to know? What do you want to leave people with?
Yeah, I would say first and foremost, if you can, or if you are susceptible to breathing difficulties, probably best to remain indoors and keep the HVAC going, like you said earlier. If you're going to be outside, consider maybe taking something in advance to prevent symptoms like an antihistamine. And then lastly, if you do have questions, like I said earlier, that's kind of what we're here for, is to be accessible to the public when there's things like this going on. And that's something that we take pride in as a profession and as a company.
That's great advice. You know, most pharmacists are right there. I love that you have that, you know, ask question part of Drug Mart. You get to walk up, get a consultation kind of thing. And in most cases, a pharmacist walks you right out and says, here, take this, or, you know, here, use these eye drops. But again, love the advice of checking on that emergency inhaler. People don't think about it until they need it. And boy, you hope that it is not expired at that point. Chris Peshek, Director of Pharmacy Operations with Drug Mart, we certainly appreciate the time. Thank you for the expert advice.
Thank you, Dan.
All right, take care, sir. Again, this is what we've been doing for the last couple of days, bringing you the experts, whether it's heating and cooling experts, whether it was the director of the Cleveland Board of Public Health. Yesterday, we had an expert from Baldwin Wallace who is an expert on the air quality monitoring sensors. all of this to help you understand what's going on and be prepared and protect your family. If we have any other breaking news, we're going to bring it to you here on our digital platforms. Otherwise, remember, we do have 3.5 hours of news starting at 3 o'clock. We're going to be on top of this, helping you navigate this latest air quality issue because of the wildfires in Canada. Until then, I'm Dan DeRose with 19 News Now. Have a great afternoon.
19 News is everywhere. Download our CTV apps and follow us on social media at Cleveland 19 News.